Hi, my name is Adam, and I'm the holistic fertility therapist and fertility lifestyle consultant here at Verdure Healthcare Consultancy in Kuala Lumpur. Thank you so much for joining me today, and thanks for telling your friends about us. Today, I would like to talk about a very important topic that every couple should know about IVF treatments, and that is, how do you choose the correct IVF clinic to increase your chance of success? So if you've been trying to have a family for some time, there is always this temptation to get on with the treatment as soon as possible. However, an IVF treatment can easily cost you over 22,000 ringgit, and with so many IVF clinics to choose from, deciding which one that best meets your needs can be very overwhelming and confusing at the same time. A quick story to get started. A few weeks ago, a client came to me and asked for help choosing the best IVF clinic. That was her second cycle, and the reason why she failed her first one was because when the physicians asked her to take the medications at a precise and specific timing and dosage, she thought she knew better than the physicians and took the medications a day late and ovulated early. So it is essential for you to pick a good medical team in whom you trust so that you don't have to be the lone ranger in any part of the treatment, especially in taking your medications. A couple of words about that. You might want to visit the Malaysian Healthcare Travel Council's website at mhtc.org.my to see if your clinic is a member of the council. Because to qualify, the hospital must possess at least one accreditation from an international healthcare accreditation body and have gone through many stringent selection process by the committee so that they are representing the best of Malaysia's healthcare. Additionally, try to find out how many cycles do they perform in a year, and what are their success rate like over the past couple of years. And you should also find out who are their doctors and what kind of experience and qualifications do they have. Besides that, you need to find out who are their embryologists and how long have the embryologists been with the IVF clinic that you chose. That's very important as well. And remember, an IVF treatment is not just about how good the doctor is, it's about the entire physician's team. In fact, the embryologists are just as important as the doctors, so get to know them well. In addition, you can also find out what other patients say about that IVF clinic, not just about their doctors nor their embryologists, but about their customer service team and other peripheral services that they provide as well. So to do that, you can visit forum.loyan.net/pregnancy and parenting. It is a great place for you to get other people's experience and comments. So if we look at recent reporting years, the IVF success rate in Malaysia can actually go as high as 79%. But be careful, some of these might just be the clinical pregnancy rate and not necessarily be the live-born take-home baby rate. In reality, the IVF treatment success rate is actually divided by maternal age. So if you are less than 35 years old, you'll be looking at around a 42 to 43% take-home baby rate, live-born birth rate. And if you are 35 to 37 years old, you'll be looking at around 32 to 34% of success rate. And if you are 38 to 40 years old, that goes to 21 to 22%. And if you're 41 to 42 years old, that goes to 12 to 13%. So for patients that are older, they might be looking at either donor eggs or even a lower chance of success. Now, I understand that it is very tempting to focus exclusively on success rates when comparing different clinics, but bear in mind that the differences of just 1 to 2% are often down to chance rather than reflecting a clinic's true capability. So, a clinic that's performing particularly well in 1 year might have a lower chance of success the following year and vice versa. So after you've shortlisted the clinics, you need to consider other variables as well, like the average cost of the treatment and your budget, the location of the clinic, Speaking of that, don't be surprised if you're asked to visit the clinic at least 5 times during one cycle. The first visit will be the initial consultation with the doctor. The second visit will be a follow-up session to see how well you respond to the medications. The third visit will be the egg retrieval process. The fourth visit will be the blastocyst transfer. And hopefully the last visit will be the pregnancy test. So if you are living in, say, Penang, it might not be wise for you to perform the treatment in Kuala Lumpur. You might also need to think about whether you're more comfortable with a female doctor or a male doctor, or a doctor that has the same cultural background as you. Besides that, you also need to consider what are the services that they offer. For example, how many days would your blastocyst be cultured? Is it 3 days or is it 5 days? The longer the better it is. And also, if you have genetic diseases like cystic fibrosis, you don't want to pass it down the line. So you need to know whether the clinic has the technology to do pre-implementation genetic diagnosis and screening, known as the PGD, PGS, or even the more advanced next generation sequencing, known as the NGS. Remember, the more informed you are, the easier it will be for you to make key decisions throughout the treatment, and the more in control that you'll feel at every stage of the process. So find a clinic that meets all your needs, expectation, and that you're comfortable with, rather than just deciding on success rates alone. Thank you very much once again. I hope you've enjoyed this video. Please tell your friends about it and please subscribe to our channel. Stay tuned for more videos and information about IVF treatments. See you next time.